So today we're going to talk about restless leg syndromes and periodic limb movement disorder, or PLMs. So there's a couple things. These are two different conditions, and what we want to do is educate our patients on the differences of these two, and that way they can understand their diagnosis and know what to do to move forward with treatment. So with restless leg syndrome, the main thing is this happens when patients are awake. It usually happens later on in the evening when people are getting comfortable and still, getting ready for bed. And it's often described as an itching, burning or tingling sensation in the legs. And what we want to do is we want to educate the patients on ways to alleviate this. And that would be things like, massaging their legs or having a family member massage their legs for them, getting up and taking a couple laps around the living room and bedroom just to sort of ease that pain going on in the legs. We also want to let them know that there is a drug called Requip, and this is the most common prescription, but we also want to let them know that we want to try to hold off on medications for as long as possible if it's something that isn't necessarily causing too much of a problem. We want to encourage things like the mild exercise or massages and things like that rather than going straight into a prescription drug. And another thing that you can mention to your patients is that RLS is often linked to people with anemia or, low iron of the blood. And so you can recommend that they be tested for this anemia. And if they have it, then that could be treated, and that could also, alleviate some symptoms of their RLS. Now, the next thing is the periodic limb movement disorders. People that suffer from restless leg syndrome have a greater chance of suffering from the PLMs. And what this is just sort of the same symptoms, and along with leg jerks. And this happens when you're asleep. In order to be positively diagnosed with periodic limb movement disorder, you have to have 15 PLMs per hour that result in an arousal. So what that means is that for every hour that you're asleep, 15 times you're jerking your legs or jerking some body part, and it's going to cause you to wake up. And so that is a serious problem when we're talking about our sleep, because if you can imagine waking up 15 times per hour, you're having a pretty bad night's sleep. So if you're diagnosed with periodic limb movement disorder, the most common things that are prescribed are things like muscle relaxers or anticonvulsive medicines. But we again want to encourage our patients to use these drugs as a last resort, and if they can do things instead like mild exercise before bed, maybe some stretching or yoga, that this would be a preferable treatment rather than going straight into a prescription medication that can always bring along side effects.